Today I'm going to talk about a big question, a big unknown for people that comes up when they're interviewing midwives is what happens when baby's born and they need some help, stimulation, or resuscitation. That's kind of scary, so let's just talk about it. So in labor, we're monitoring baby's well-being with a Doppler, and we're doing frequent monitoring not only to make sure that the baby's range of heart tones stay within a normal range, but that the pattern of them is normal relative to a woman's contractions. So when baby's born, if we've had normal heart tones and a really well oxygenated baby, we know that when they're born, they can take 25 or 30 seconds to make that transition to room air, and that can be really normal. Remembering that they have the umbilical cord still attached to mom that's still delivering oxygenated blood to all their vital organs while they take that time to transition to room air, all the more important reason not to clamp and cut the cord immediately after birth. If a baby does come out and is a little bit sluggish, or we don't like the muscle tone or the color, particularly the muscle tone tells us the most about the well-being of the baby and their interest to kind of come around here and transition, then there's a few things that we do to get involved. The first thing is right on mom and dad are talking to their baby. Midwife gets in and we manhandle that baby, often kind of just tipping them up, rubbing them upside down, getting that extra fluid out of their lungs. Their lungs are filled with fluid in utero and they have to get rid of that when they go to... Okay, so rubbing them up with a blanket or bugging their feet isn't quite enough to perk them up. The first thing most of us go to is a sterile bulb syringe. We open this up and we suction the heck out of their mouth and their nares, and that's usually enough to bug them. When they go to breathe, their first action isn't an inhale like you would think. It's actually an exhale. They're getting rid of all that lung fluid. It's going into their tissues, and they lose weight the first few days because they're actually peeing out their lung fluid. Once in a while, we have a lazy baby who needs a little reminding in how to transition, and we are certified in neonatal resuscitation, and I also hold biodynamic resuscitation of the newborn for out of hospital, and we carry equipment to help them get the fluid out of their lungs. The national statistic on how many babies will need some form of stimulation or resuscitation is about 10%. I think in home birth, our numbers are better because we're dealing with really low-risk moms. About 1% of babies will need help beyond what most midwives can offer. Hopefully that answers one of the big unknowns that can be kind of scary for people about how do midwives deal with a potentially big complication. Go ahead and DM me if you have any other things you want discussed, and hope to talk to you guys soon.